We'll be continuing in this event, and I'll be privileged to be introducing our next speaker, who will be speaking to us on why medics should lead digital health innovations and the value of cross-sector collaborations with health tech experts. This is really going to be an amazing and very, very insightful section. It's going to be taken by none other than Dr. Chisom Nri-Ezedi. I'm sorry if I did not get the name right, ma. She's a pediatrician and an associate professor, a data analyst, a software developer, a digital health innovation. In summary, to die for. She's a versatile leader dedicated to shaping the future of healthcare through digital innovation and academic excellence. As a distinguished pediatrician and associate prof, she brings unparalleled insight and dedication to patient care and scholarly pursuits. Her commitment to advancing healthcare is further underscored by founding of the medical hub Pete Cow, which you can find on the Google Play Store. It has over 1,000 downloads. I'll just type in the app so we could check it out. The platform, conceived and developed under her leadership, has democratized access to vital healthcare resources, enhancing patient outcomes and accessibility globally. Today, we have an amazing privilege of hearing from Dr. Chisom as she shares her insight on the pivotal role of medics in digital health innovation. Please, everyone, let us join me in welcoming Dr. Chisom to the podium, and let's have an amazing time. Thank you, Ma, for making our time to be with us. Over to you. Looking forward to a very amazing presentation.
Hello, thank you very much, Efe, for that kind introduction. So, good afternoon, everyone. I don't know, do I share my screen or do you want to do it for me? I'll prefer to share it, please. Okay, so let's do that. The screens. Okay, then. So, good afternoon, everyone. So, I'm Dr. Chisom Nri-Ezedi. I'm a pediatrician and an assistant professor, otherwise known as senior lecturer here in our environment. So I just got to learn that people from other countries are here. Well, you're welcome to this particular presentation. So this will be my outline, the introduction, status quo, the role of medics, several case studies, challenges, conclusion, and of course, the way forward with questions and answers coming later on in the day. But before I go into the status quo, I'd like to talk about, briefly about medics and why we should be involved in digital health innovation. Like I mentioned earlier, I'm a pediatrician. I'm also a lecturer, but at the same time, I'm a programmer, a Python programmer. I started out initially as a data analyst using Python to analyze my data set for research because I'm in academics, and if you don't publish, you perish. It's a common saying, though. So I have several researches under my belt, all analyzed with Python. And in learning how to analyze with Python, I got introduced to data science. So that's something I want to also add to my list of skills. And recently, I also entered into software development, like he mentioned earlier, Efri. I have an app that is being published on Google Play Store currently. So the reason why I mentioned all this is that I'm very passionate. Ever since my medical student days, residency days, I've been passionate in the idea of leveraging technology improvement of healthcare delivery, particularly here in Nigeria. And the reason is they're obvious. There's brain drain, very few manpower, lots of patients, because if you check it, the population of this country is not decreasing. If anything, is increasing. So the patient load is increasing. There are very little doctors or healthcare personnel to attend to these patients. What's next? The next thing is to develop digital health solutions to these rising problems. And we can't deny the fact, excuse me, we can't deny the fact that currently, we're in an era of increasing advanced technology. We are in an era whereby technology has nearly permeated in every aspect of our lives, every aspect of our lives. Just think about it. If the internet right now decides to stop working, can you imagine how your daily life would be like? Believe you me, it's going to be difficult because you can't do anything. You can't make any transfers. You can't check your messages. You can't do anything. So we are in a timeline whereby technology is at the forefront of vertically everything. And it's very important for doctors to understand this and embrace digital healthcare solutions in order to harness its power and transform healthcare industry as we know it. So the time to act is actually now. And the reason why I decided to start out with this little bit of introduction is that we need to understand where we are right now to be able to know where we're going. Because right now, the situation of things in this country is that there's limited digital literacy. There's limited, and it's so enormous and so grave that it's actually becoming a source of concern to me. I'm sure many of you here are aware of ChatGPT. I did a recent research whereby I shared a questionnaire, a kind of a mini survey to virtually all doctors in the country, trying to find out how many of them know about ChatGPT and its benefits or utility in healthcare. And nearly almost two-thirds of them are not even aware of ChatGPT. They don't know what it is. They've never heard of it before. And that was deeply concerning to me. And there's this also a limited exposure to product development. Most people don't know about medical apps. They don't know. But recently, people in my institution knew about Google Sheets and how we can integrate it into research, collection of data and how it's free. People don't know this. They're slow in learning these things and knowing about these things. And it's very, very concerning because if we don't address these things now, then our goal of integrating digital health and all that will not work, particularly when it comes to healthcare industry. And the earlier presenter, the first presenter talked about this resistance to change, because even though we are aware of the utility of these digital health innovations and solutions, even though these solutions are available to us, believe you me, resistance to change is an actual problem. It is an actual problem because in my institution, I'm going to give lots of examples in my lecture because I've experienced several of these things firsthand. In my institution, EMR, electronic medical health recording, was introduced several years ago, and nobody used it. It was very difficult for doctors, for nurses, for virtually everybody there to use the EMR. And so several months later, they reintroduced it again, this time around using tablets rather than computers. And it was still the same problem. Nobody wanted to use it. And the reason was very simple. The people who developed it didn't take into cognizance the local environment, the local doctors out there. There were so many icons, but looking at it, you can clearly see that the EMR was tailored for maybe doctors or healthcare professionals in US and UK. It had no local touch. We didn't really understand it. But most importantly, this aspect of brain drain, this JAPA syndrome that keeps flying around. People don't want to work here anymore because of poor pay and whatnot. So you have very little doctors, very large amount of patients. Why would you spend all that time trying to type out their problems and issues when you can easily just write it down in paper? So of course it didn't work. It didn't just work. But recently, the current CMD in my institution did something that was quite fantastic and studied the situation, understood the prevailing issue of resistance to change. And what he did was he removed completely the folders of every single patient in the, I mean, it had a folder, it was kept in the archives, but no new folders were being produced anymore. So all the healthcare professionals in the institutions were forced to use the electronic medical health recording. And that is actually how we came about using it. So resistance to change is a serious problem. It's not enough to sit back and think, oh, I've developed something that can cure this or that can do this. Always understand that there is that resistance to change, particularly as concerns our environment. And then inertia in the system, bureaucratic inertia. You've come up with this solution. It's fantastic. It's groundbreaking. It's thought-provoking. But again, you have to understand the environment that we live in. I don't know whether it applies to other African countries, but I'm certain about Nigeria. You've developed this application, you go to your boss, you present it to them, and they'll say, oh, that's wonderful. Write a proposal. You've written the proposal, and then it proceeds to move from office to office. And by the time it gets to the chief medical director or the health minister or the commissioner of health, that may take about several months. And by the time they call a meeting, I mean, it's a whole, I don't know. So it's a whole lot of problems, and this is the situation at hand. But despite these problems, these challenges, we must remember that digital health technologies have the potential to reduce inefficiencies in healthcare system, to improve access to care, and to save lives. This is from the World Health Organization. I would like to add to this. It reduces cost as well. It's very cost effective using digital health technologies. And so it's very important for us to understand our role as medics in digital healthcare innovations. When I got this topic, I understood medics to mean medical doctors. Okay, I understand that there are diverse roles of people here, but with respect to this lecture, I'm referring now to medical doctors. So what is the role of a medical doctor in digital health innovation? One, clinical expertise. I'm aware that there are several doctors here, several medical students. So let's go through the journey that we all pass through. First of all, you enter into the medical school, you spend 6 years technically, because with industrial actions and whatnot, you may actually spend an average of 8 to 9 years. So you pass out from medical school, you spend 1 year as a house officer, spend another year doing your youth corps. And back then in my days, everybody wanted to be resident doctors. So imagine spending an extra 6 to 10 years as a resident doctor before becoming a consultant. Now everybody wants to leave the country, but it doesn't matter. All the years spent in school, in postgraduate training, you're in contact with patients, you understand the complexities that goes into their management, you understand the clinical nuances involved, collaborations with practically all the healthcare professionals. You're in tune with all that because you've gathered this wealth of experience over the years, nearly almost decades by the time you're done, with your training and being a consultant and whatnot. So who better really to lead, or let me not use the word lead, or to collaborate with when it comes to digital health innovation, if not the medics? Think about it. If not the medics. So the clinical expertise is something that one shouldn't throw away. And then the second one, which for me is very important, I came to realize this recently, is the user-centered design. When I developed my app, the app I told you about, is an app that actually calculates things for pediatricians and whatnot, because I'm a pediatrician. So that was my main interest, coming up with calculations to help with that problem. But I realized something. Programming the calculations was not a problem. I did that in a few hours and I was done. The actual problem that I had in building that app was the user-centered design. Because I got to thinking, what colors will a doctor like? Because I can't just wake up and use any color that I want, maybe pink or anything. I have to use warm colors or colors that evoke certain feelings, because an average doctor in Nigeria is stressed out. I've talked about it several times, brain drain and whatnot. An average doctor is stressed out. You have work pressure, family pressure, maybe exams and whatnot. So I needed something that when they open the app, they feel comfortable. The colors are not too overpowering. I needed a design whereby if the doctor needs an answer to something, it's very quick and easy, very simple. So the user-centered design is truly one of the key foundations, towards the success of any innovation or any app. So one must pay attention to that. So if you're a tech expert building an app, and you don't take into cognizance of the fact that these doctors may not like this design compared to so and so design that you're used to, maybe when working with another group of people, you may actually have a product in your hand that may not sell with respect to doctors or even the patient, because the doctors can tell you what designs are appropriate for patients. Like, I'm a pediatrician and I already know what mothers or fathers may want to see with respect to their children. So it's very important, user-centered design. Another is research and development. Okay, you're building the first presenter, Thomas's Great, talked about wearable devices, a device that can detect the pulse SpO2 of a person. So imagine you're a tech expert and you're developing a wearable device that can detect something in the human body. How on earth will you know if the outcome of that device is actually correct, is accurate? There's no way you can tell without engaging the services of a medic or a healthcare professional who is proficient in that field. You can't find the answer to that unless you engage them. So in production, if you want to know whether the outcomes are accurate, you need the services of a doctor. That collaboration has to be there. If you deploy it into production, by that I mean if you finally release the app to be used by every other person, you still need to gather data to see how the app is performing over time and across different variables. By variables, I mean age, sex, profession, temperature, humidity, and all that. You need to gather all this data. And if you gather them, at the end of the day, you still need the doctors to look at it, interpret it, weed out the confounders, look for outliers, and whatnot and whatnot is very important. So research, development, medics should be at the forefront of this. And finally, integration of technology into practice. I'm going to give another example. You've developed this wonderful device that can maybe detect, again, an example, cancers in children, and you want the doctors to use it. Like I mentioned, in addition to resistance to change, most doctors may not even be interested. Believe you me, this is an actual problem. So you need, again, the medics to go out there, marketing this product, train junior doctors, or in fact, any other doctor, it mustn't really be junior, telling them about the utility of the app, the research that has been done. It's just something similar to what pharmacists do when they are showcasing or marketing a drug. You need the medical doctors to talk about your apps. So this is one of the few reasons why the medics are very important, their role when it comes to digital health innovations.
Are you still wondering what to expect from medics in tech community? Then, get ready for updates on cutting-edge advancements and the latest breakthroughs in the digital health space. Follow us for inspiring digital health stories. Most importantly, get ready to upskill your health tech IQ with our curated courses, webinars, and digital health events. Go straight to medicsintech.com now.
And then finally, advocacy and adoption, because at the end of the day, people need to use this app. So you need the doctors to, talk about your app based on their wealth of experience. Now, talking about the cross-sector collaboration is essentially what I've mentioned earlier before. The tech experts are proficient in that field. They are the ones that build these apps. They are the ones that develop these things. Believe you me, there are doctors out there who can do these things as well, but I want to believe that they're not as effective, or proficient as these tech experts, because we all have our different fields. The doctors have spent time learning about medicine and whatnot. Any healthcare professional, the same thing, spend time learning their profession. Then the tech experts are doing the same. They've gone to school. They've been the ones building these products over years. They've gathered an experience. So what's better, it's better actually to combine these two teams rather than one person trying to be a jack of all trades, master of none. That's my opinion, though. And again, I say this from experience because even though I'm a programmer and a software developer, I understand my limits. And I know that there are people out there who are so good at this. And that is because they've been in the industry for donkey years, 10 years and counting. Of course, they will know more than that. Similarly, the tech experts shouldn't know what I know as a doctor because I spent nearly 20 years as a doctor. So I don't expect a tech expert to know more than me. It's not possible. So if you bring these two teams together, can you imagine what the output will be? I mean, it's going to be fantastic and excellent. So it's very important. Collaboration key is the hallmark of digital healthcare innovation. And I want to encourage any tech expert listening to this to please engage the services of healthcare professionals, not just doctors, nurses, lab technicians, pharmacists. I mean, the list is endless. Always think in that direction, and believe you me, your app will be better for it. And I also want to, I've mentioned a few other things why medics should collaborate with techs. I'm not going to repeat myself again, but now I want to talk about the examples of digital health innovations. And in terms of popularity, you have the telemedicine. There are quite a number of them in Nigeria. I think I want to mention one, Easy Care, because I registered with them a few years back, and there are so many doctors using the app. And I learned that in Lagos, it's quite a big deal, Easy Care. Then you have the mobile health apps. If you open Google Play Store, there are lots and lots of mobile health apps. And of course, the in thing now, AI-powered diagnostics. Talking about this is like opening up a can of worms. We're never going to end it because as a data analyst, I mentioned that I also want to be a data scientist. I'm actually working towards that. So if you think about it, machine learning, supervised learning, unsupervised, deep learning, image processing, natural language processing is a whole world of its own. And people are harnessing its power into building digital health and products. So it's quite interesting, really. And I want to point out some of the existing products that are already available. You have DeepMind, which is a subsidiary of Alphabet Inc., that's Google. And there's Zebra Medical Vision, which use AI to analyze medical images. The first presenter, when I was listening to him, he said something, and something quite intriguing that I'm sorry to say, but I disagree with. He said that even though that AI is out there and doing several fantastic things, that he believes that it's not going to replace humans, in healthcare industry, because we still need the human touch. I disagree with that. I disagree with that because if you think about it, look at ChatGPT. Look at ChatGPT. ChatGPT is a model that was trained and is still being trained with trillions of data, text data, trillions of it, trillions. And you can't show me an individual on this planet that has the same knowledge, database as ChatGPT. It's impossible. You have to be a superhuman for you to do that. Now, when you talk about medical images, for instance, some of these models that are available now are being trained on millions of CT scans or X-ray images or whatever images there are, slides and whatnot. Again, there are no humans out there who have had that experience of going through a million slides and all that. Yes, I understand the human involvement, but again, we have to understand that we're now in an era whereby the computers may actually be better than humans in certain things. So if I know that I can just get this model, integrate it in my X-ray machine and get the diagnosis being churned out, and the accuracy is close to 100%, maybe 99.9%, why would I need to employ a radiologist, for crying out loud? I won't do that. Or even if I need to, I'll employ just one just to cross-check what the AI model is churning out. But I wouldn't have to employ so many radiologists, particularly in large institutions. I would just need only one or two, and that's about it. So the time has come whereby AI has come to stay already. Big companies like Google, they're laying off staff. Some of them we get to hear about. What about the small industries? I'm pretty sure they're laying off staff as well because of ChatGPT and all the other like Midjourney that can create images. Why would I need a graphic artist when there's Midjourney? I mean, there's so many things happening right now that we may not know about, but people are literally losing their jobs because of AI. And it's going to trickle into the health industry very soon. And that's why it's very important that everybody should be up in arms and learn to diversify, to embrace technology and use it effectively, if not for anything, at least to save your jobs. And then finally, there's another company out there called Stratasys and MacForged. They are printing prosthetics, surgical models, even tissues using 3D printing. Again, if you think about it, there's no way they can do this without engaging the doctors or other healthcare professionals. Because how on earth would they know about surgical models if they don't get a surgeon? Prosthetics if they don't engage an anatomist and all that. So you can begin to understand that the time has come whereby we have to really expand our minds, that whatever we're doing should really go beyond medicine, and we should think about integrating digital health solutions in every aspect of what we do. So I've talked about the future of digital health with advancements in technology like artificial intelligence, machine learning, big data. The potential for groundbreaking digital health solutions is immense. And McKinsey and Company in 2023 predicted that the growth of global digital health market can actually reach to the tune of $630 billion. And in Nigeria, to the tune of $3 billion. That's in 2025. And then if you talk about the local statistics, doctors in Lagos, up to 50% of them are estimated to use telemedicine platforms. And I believe this because in Easy Care, the platform I talked about, the telemedicine platform I talked about, when I joined them, I realized that I wasn't getting any engagement whatsoever because I stay in Anambra State. And apparently the people here don't understand anything about digital health solutions, majority of them, particularly the patients. Most of my patients don't even have WhatsApp. That's how bad it is. But I heard the customer care agent in Easy Care told me that in Lagos, most patients, the only way they can get in contact with their doctors is through the app. So I actually believe this figure. And then currently 70% of smartphone users have downloaded at least one health app. So we need to understand that we are quite in a different era from what we're used to. We need to be up in arms in whatever it is we're doing because times are truly changing when it comes to digital health. And then several apps in Nigeria like Doctura by Dr. Debo Odulana. It's an online platform that connects patients with doctors. And then there's 54 Gene by Dr. Nne Obong et al., a genomics company using AI for disease prediction and personalized healthcare solution. And then AI-powered diagnosis, I've mentioned some of them. Apparently, they are already here in Nigeria. I'm waiting for it to trickle down to my institution, and it's going to be something amazing, really. And I also want to present my own app. My humble self. This is just an app I published this year, January 6th. I got tired of my junior doctors and medical students always having to calculate something and wasting so much time. If you want to calculate something like body surface area, it literally takes minutes, and GFR meaning glomerular filtration rate, checking the status of the kidneys, that takes more than a few minutes. So I got tired of the whole delay. If I come for my ward runs, I'd like to leave on time as much as possible. So I had to develop this app. So it's an app that you can find easily on Google Play Store. It has over 1,000 downloads, and currently the ratings are up, and I'm pleased to announce that it has a 4.8 rating. And that's it. So what are the challenges out there? Well, I've mentioned quite a few, but I have to point out something that nobody really talks about: the time constraints. Time constraints. Again, talking from the doctor's perspective, we simply do not have time. How can we have the time when there's so many patients to see? The same applies to all professions, really, nurses and all that, because of brain drain. I've talked about this over and over again. People are pressured. There's burnout syndrome going on currently amongst doctors. People are literally tired. There's pressure every single place. And with this economic decline, I think this morning a dollar is almost close to 1,600. Food prices are going up. There's no electricity, there's no energy, there's no nothing. People are pressured. And here you are bringing in the solution of digital health, and all. They're not inclined to listen to you. So we need to consider that, yes, digital health solutions, very important. But then again, we have to pay attention to all these other factors, so that if we're trying to sell a product or tell doctors or indeed our patients to embrace a product, we should understand the situation on the ground and trying to find ways of mitigating it in order to increase adoption of whatever digital health products that we may have. And then there's technical barriers. Technical barriers in the sense that in medicine, it's unique in the sense that you're dealing with data. And if you're dealing with big data, you have to understand that you're dealing with human data. In other words, you should be aware of privacy laws when it comes to data. You must be aware of the ethics involved, and then the security. Again, it's not a big issue down here because nobody really, we don't really have big data. Even most doctors or most hospitals don't use electronic medical recording. And when they do, they haven't started utilizing the data to make research-driven decisions. But in places like the United States or United Kingdom, I am aware that several institutions have been sued because of infringement of data privacy or lack of sufficient data security. But then again, it's something you have to understand there's a problem and can be a barrier, so that if you're developing this app, you should be aware of these laws, not just in Nigeria, but in any other country you're hoping this app will be used in. Ghana or Botswana or any other country, be very careful of their laws and try to keep to it. Then resource limitations, very important. We all know. And in this country, the budgetary allocation to health is so poor. And it cuts across all sections, really. An average family is unlikely to spend so much on health. They'd rather spend it on something else. Even doctors are being paid poorly, and not just doctors, other healthcare professionals as well. They're all being paid poorly. So there's this restrictions or limitations when it comes to research, and that can impact on digital health innovations or creations. But then again, we need to understand that at the end of it all, if we think about the utility or the benefits of this, which is the impact on patient care, then perhaps we can sit down and think of how we can address these challenges in order to have this goal being attained. And so I want to point out several ways that we can address some of this, one of which is to invest in digital literacy and training. That's very important. And then we should promote interdisciplinary collaborations. Okay, I just mentioned that with tech experts and indeed with ourselves. Integrate digital health into medical education. Personally, I am passionate about this particular point, not just medical education. I feel that digital health, indeed programming languages, should be taught as early as from nursery/primary school, so that it becomes a way of life By the time you get into your different disciplines, you can then apply it to address several issues or problems or concerns. So integrating digital health into medical education is very important. Supporting innovations and entrepreneurship at the medical student level, at the doctor level, and whatever level is very important. Advocate for policy change. Policy changes, very important. The bureaucratic inertia I mentioned about, that should be addressed. Then promote a culture of continuous learning, and of course, addressing equity and access. The first speaker talked about it, and when he was saying it, I smiled because it's an actual problem. Remember one of the statistics I mentioned, 50% of doctors in Lagos use some form of telemedicine platforms. Down here in Anambra State, I do not know of any. I haven't done my research, but then I speak with my colleagues. Nobody uses it because the patients that you want to use it for don't even use this platform. They don't know what it is. They don't know what it is. It's as simple as that. They don't just know. So there's this wide gap between the urban areas and the so-called rural areas. I mean, this is happening in the heart of Anambra State. Can you imagine what's going on in the villages? Can you imagine? So we need to really think about that, addressing equity and access. The rich shouldn't be the ones that should be enjoying all these innovations and good medical healthcare. We should think about making sure that everybody has at least the same degree of healthcare solutions across board. So in conclusions, medics are not just participants, which is the case, has been the case, and is still the case, but leaders in the realm of digital health innovations. And I want to quote Bill Gates: the advance of technology should be so that it fits in. No one should notice that you're even using the technology because it's part of your everyday life. And when I saw this quote, the one product that came to mind was WhatsApp, and I think Google Chrome, Gmail. There's so many of them because they're so much a part of me now that if you remove them from my life, like I mentioned earlier, you stop the internet from working, there is going to be a serious problem. There will be a serious problem because nothing is going to happen, really. So in light of that, let us all work together to make digital health an integral part of everyday healthcare, and in doing so, shaping a brighter future for us all. Thank you very much for listening.
Are you still wondering what to expect from medics in tech community? Then, get ready for updates on cutting-edge advancements and the latest breakthroughs in the digital health space. Follow us for inspiring digital health stories. Most importantly, get ready to upskill your health tech IQ with our curated courses, webinars, and digital health events. Go straight to medicsintech.com now.